The treatment of IBS can be frustrating for both the patient and the physician. It's frustrating for the patient because there's a lack of validation by several healthcare practitioners for IBS. It's disregarded as a stress illness. It's regarded as, just sleep better and you'll exercise more and you'll be fine. And patients are lacking validation because they're suffering and they've got a lot of issues that they're dealing with. And on top of that, they're feeling stress and they're not being validated by their healthcare practitioners. From the practitioner point of view, it can be frustrating because there's no clear blood test, there's no diagnostic imaging test, there's not a lot of positive things. You have to think from a doctor's point of view that when you do an ECG and you see a certain heart attack squiggle, then it's a heart attack. That's the diagnosis. So there's none of that in IBS. So it can be very frustrating for the physician, and there's always the fear of missing organic disease, even if the chance is very low, and study after study is demonstrating that. The first treatment for IBS is diet. So diet is something that we usually do with a registered dietitian in order to, it's not something you're going to just read off Google and start. You need to make sure that you do not have a deficiency in the micronutrients. And the diet that's been shown the best for IBS is FODMAP diet, which stands for fermentable oligosaccharides, disaccharides, and monosaccharides, and polyols. Now, FODMAP, FODMAP, is a diet that is easily digested. And the reason that the FODMAP works is because the foods are digested quickly in the GI tract, so they don't migrate all the way down to the small bowel where all of the bacteria are. And remember that IBS patients have a greater number and change in type of bacteria. So if you're not feeding those bacteria more, of course, they're going to feel better. FODMAP is a 2-month trial, and patients who do not have IBS don't see any changes, but patients with IBS feel better on the FODMAP diet. I would recommend this to be done with a dietitian because you need to reintroduce foods after, and I would do it in conjunction with your practitioner because FODMAP over the long term is not good. Therefore, you need to work on the microbiome at the same time. Long-term FODMAPs and other types of diets, such as ketogenic diet, are usually lower in prebiotics. So remember those soluble fibers and short-chain fatty acids and resistant starches. So those are things that are needed for your colon health. So if you don't eat a lot of prebiotics because of your symptoms over the long term, that's not good for your microbiome. Other diets that have been shown to be equal to FODMAP is gluten-free. So you don't necessarily need to go gluten-free and FODMAP. Some people are sensitive to dairy, so removing dairy as a trial is another avenue that you could try.